Scrolling blood transfusion and compression device. Blood transfusion is the intravenous injection of blood product into the recipient's blood circulation to treat severe anemia or massive blood loss, with the most commonly provided product being packed RBCs, in addition to the use of blood warmer during blood transfusion to maintain the blood product at 37 degrees Celsius and avoid arrhythmia. A transfusion should be completed within 2 to 4 hours to avoid bacteremia, which endangers lives. Clinically, blood product is transfused into a human vein through the use of gravity and altitude infusion. However, blood product thickness increases the longer the blood product is kept at room temperature. Small venous blood vessels thus result in a lower flow rate, and a blood pressure bag is employed to transfuse packed RBCs into the recipient's body through the use of pressure. To maintain the appropriate pressure, nurses must go to the ward regularly and compress the bag manually. Their busy clinical work often prevents them from performing this task immediately, which results in late or sporadic infusion of the blood product and requires the product's re-preparation. In addition to this being a waste of medical resources and personnel, this method is also incapable of timely provision of the hemoglobin required by patients, exacerbating concerns regarding patient safety. Scrolling blood transfusion and compression device. Design principles of the invention. The proposed device uses internal counterweight parts, a groove, a driving wheel, a driven wheel, a knob, a coil spring, a lock, and switch etc. to perform automatic compression. Procedures. Unlock the fixture. Pull out the driven wheel. Connect the blood bag to the blood transfusion tube, and hang the blood bag on the groove of the driving wheel. Replace the driven wheel. Lock the fixture in place. Pull downwards the switch. Turn the knob counterclockwise to its limit. The coil spring is forced to its tightest state. Pull upwards the switch. The blood bag is spooled upwards. The blood bag is driven around the spool and squeezed by the pressure bar. The coil spring is tightened slowly. The blood bag is subjected to continuous and timely compression to achieve a pressurization effect until blood bag emptied. Marketability of the invention. This invention has market value for the following reasons. It can pressurize a bag of blood product continuously without requiring human intervention, as is required in occasional manual compression. It does not require electricity and is thus energy-saving and environmental friendly. It can be reused after alcohol sterilization. It has a simple structure and is easy to operate. It has low development and repair costs. No patent for a scrolling blood transfusion and compression device has been granted. It has won Innovation Competition Awards, which demonstrates its clinical practicality.